So, Dr. Rahul, moving towards a very important topic of our podcast today,
Mhm.
there's a lot of stigma around one topic, which is men's sexual health.
Okay.
There are many men who face problems like ED, which is erectile dysfunction, and PE, which is premature ejaculation. So, according to you, and they're equally embarrassed to talk about it.
Very true.
According to Ayurveda, what are the common roots or root causes, in fact, of these problems?
So for both of them, actually, it starts with P or premature ejaculation that might eventually lead to erectile dysfunction. Uh, the common thing both of them have is either there's a psychological issue of either stress, anxiety, performance issues, or maybe people having certain notions like because of the exposure to porn and all those things, people feel that they should be lasting for a very long time, whereas the average timing for India or the Indians is very small compared
Mm.
to the other Africans and all those things. But an average time of 7 to 10 minutes is the ideal time which one should be thinking. Again, the problem comes down that those people who don't perform more than a minute or maximum 3 minutes, they are categorized into premature ejaculation or as such. And one of the causes that causes it is starting with the stress factor. So most of the time it is said that the sex is not between two legs, it's between 2 ears. So what you are thinking, what's going on inside your head matters a lot. Even the women as well as for the men. So if the person is in a different thought process, he's in his stress, but he's just performing because he wants to release his stress, then definitely premature ejaculation would happen. On the contrary, even if he has eaten a lot, he's obese, he has certain conditions inside us like diabetes and all those things, definitely he will have a performance issue. So again, the food becomes a very crucial
Mm.
part and the exercise becomes a crucial part in ensuring that the premature ejaculation doesn't occur. Now you would be thinking why exercise comes into play, because exercise is something that will ensure that all the serotonin and oxytocin kind of the good happy hormones are released inside your body. So depending upon your constitution, you need to be working out. Like if you are a heavy built person, doing yoga won't help you. Okay, it would just calm you for sure, but it won't help you in terms of an exercise for the body. It would just act as a calming thing. So for those kind of people, having workouts like going to gym, swimming, exercising a lot, or maybe doing Surya Namaskar and all those kind of rigorous physical movements would ensure that they won't land up in all these problems.
Okay.
Similarly, a person who is very thin built and he doing gym will trouble him.
Right.
For him, having yoga or the simpler form of exercise would be recommended. So again, your diet and to that you need to add to your diet. Now the diet doesn't mean having fancy things like anjeer kha lo, musli pak kha lo, ye kha lo. Whatever you are eating has to be in sync with your constitution and is to be sync with where you are living and the season that you are having. If you follow this, it's very easy to have a good sexual life. Now, this PE or the premature ejaculation over a period of time, plus with many other factors, gets converted into erectile dysfunction. Now, erectile dysfunction may also occur with or without a premature ejaculation. But in those cases, it's usually the predisposing metabolic conditions which actually cause that dysfunction. For a person who's having dysfunctions, it's very important to get the root cause treated. If he doesn't do, it will lead him to a very bad self confidence. He may
Right.
land up in depression or have a very bad marital issues, because uh, for any kind of a bonding, especially in between a male and a female, as a husband and wife or as a partner, sexual bond is much more important. I always say, when you are as a couple, if you don't have a sexual life, you are going to have a ruined future.
Correct.
It is more important, and it doesn't mean having like वो पॉन की तरह दिन भर करते रह रहे हैं, even though it's once in a week or something, that intercourse is the one that keeps the relationship going. So therefore, for them to ensure that this relationship is fine from both the ends, it is very necessary to get these things treated. Uh, what people think is that I need to find a quick fix rather than
Correct.
speaking with somebody. That won't ever solve the problem. Even if you go to a doctor or a therapist or something, unless and until you speak to them, you won't find a solution. Because, like I said before, it's majorly a mind game at times.
Mm-hmm.
You need to just verify whether it's really a mind game or it's a really a metabolic disorder or some problem, a medical problem that you need to get resolved. So that person, the doctor or the therapist, would be the one guiding you or bifurcating your path. Okay, if it's a psychological thing, just a phobia or something, that person would be the one who would actually be helpful. But
Right.
if it's a medical condition, then you need medications and doing those
Correct.
stuff. So it's always necessary to speak up
Right.
with somebody at least to get an idea.
True. Also, Doctor, the healthcare industry or the
Hmm.
health markets are filled with, as you mentioned, these quick fixes. There are a couple of tablets available, oils available, and
Correct.
multiple things that men resort to in
Correct.
order to kind of have their problems
Problems.
resolved. I want to understand from you, what are the long-term dangers or implications of these quick fixes? And if a person doesn't re- resort to all these things, what are the naturally available solutions to his problem?
Uh, if you are speaking of quick fixes in terms of allopathic medicines like Viagra and all, they are always harmful, like tadalafil and sildenafil and all those things, which are known as commonly Viagras and all. They are going to be a very big problem for you because they increase your heart rate, they shoot your BP, and then you may suddenly land into a cardiac arrest or something.
Right.
So unless and until a doctor prescribes you, maybe a sexologist doctor, but or an endocrinologist, if until and unless he prescribes it to you, you should not be getting into all those things. At any medical shop, it's very easy. The pharmacist just tell them, "आप ले लो, कुछ नहीं होता है," and all those things. But it should never be done because these medicines can kill you at any point of time.
True.
क्योंकि आपका हार्ट रेट जो है नेचुरली बढ़ता है ड्यूरिंग सेक्सुअल परफॉर्मेंस, एंड ऊपर से दवाई ली है तो और ज़्यादा बूस्ट अप होगा, सडनली दे माइट बी अ हार्ट अटैक. सो देयरफॉर इट्स नेसेसरी टू ensure that it's taken under medical supervision. In terms of Ayurveda quick fixes, which are usually seen on TVs as an advertisement and all, these don't act as fast as a Viagra would act, but still they would give a similar kind of effect. But again, this would be just a performance based kind of a medicine. It won't be a permanent cure for their whole problem.
Right.
But the sad part is people feel कि मेरा आज का काम तो हो गया,
Hmm.
तो ये चल जाएगा. And then what happens is eventually taking from basic medicine to the more higher, and then when they reach a point in life where they are say somewhere around 50, 60, and then अभी किसी से कुछ नहीं हो रहा है, then what to do, what's next? That is when they think, okay, I should speak with somebody. But it's eventually too late for them to actually get results.
Right.
So therefore, it's necessary to understand your problem, consult a doctor on time, get it checked, and you can say uh, treated at a proper time so that at a later stage you are not suffering from them. Uh, whether it's harmful or useful for the body, it's again, especially with the Ayurveda, I would say it's not that harmful, but yes, it's not a permanent solution.
Correct.
These days, Shilajit is being promoted a lot. So, actually, Shilajit, if you see a textual literature, it has very less to do with the actual sexual issues. It has more to do with the, uh, you can say, diabetes, what's so-called diabetes, or wherever the body has become too lethargic. That is where it actually works. It won't
Okay.
work for somebody who's working out the whole day, having a good body, maintaining a good lifestyle. It would be a waste for him. Somebody who's totally lethargic, not doing anything, now he's having diabetes or some grave condition, and he has this sexual issue. For them, it might be a solution. But again, the way people consume these days, like a natural resin or something. That is not it is how it should be. We call it as Shodhan Prakriya in Ayurveda. So
Mm.
Ras Shastra is a uh, mineral section of Ayurveda where they tell you how to have minerals like gold, silver for the body, which can be
Mm.
consumed by the body. So there is Shodhan Prakriya. Without that Shodhan Prakriya, having resins won't ever solve the problem. And if you go to the pharmaceutical way of making those things, it would be a loss for them because they cannot sell it at that cheaper price because it's
Correct.
after this detoxification or the Shodhan process of that Shirajit, it would be a very small portion that is left out. So therefore, what you get in market may or may not be actually useful for you overall. So if you are having it, take it from an Ayurveda doctor or from somebody who's into Ayurveda and who you know that he has done this detoxification process, then only it's useful.